Okay. Hi, everybody out there. And by everybody, I mean, us in our various offices working on this telehealth webinar. My name is Elizabeth Johnson Phillips. I am the content developer for MPWRSource, and I am here today with my panel of experts to discuss all things telehealth, what you need to know in terms of technology, what you need to know in terms of how to let your clients and patients know you have this opportunity, what you need to know to make sure everything is compliant and above board. And we're also hopefully going to hear from Dr. Mancia on what it kind of looks like to have in place. I want to remind everyone, if you are not speaking, to please have your mic on mute. It does sound a little bit like some background noise. If someone's making some coffee or doing some construction. That is what I'm hearing right now. So I'm going to go ahead and introduce our panelists. I'm going to start off with Angela Simmons. She is the principal consultant for Centrovance Consulting, who knows all things compliance and HIPAA and OSHA, and she is the boss lady. You do not want to cross her, and she's going to tell us just a little bit about her expertise. She can stop laughing. Oh, wait, you're still on mute, Angela. The rule is if you're talking, don't mute. If you're not talking,
I hear that feedback.
Yeah, we need it. Somebody needs to mute their phone because that's really, I can't, it's very difficult to hear.
Yeah, Dennis, are you on mute?
Dennis, are you on mute?
Right now.
I'm not, I am now.
Dennis.
Dennis was our problem. Okay.
Dennis, you were the problem.
Yep. So my name is Angela Simmons. I am the principal consultant managing partner for Centrovance Consulting. My background is in education and in healthcare compliance, regulatory compliance. So as a general rule, I'm working with clients on a day-to-day basis, looking at OSHA, HIPAA, infection control, and other regulatory concerns that they may have. With COVID-19, we're taking a closer look at making sure that, first of all of those regulatory concerns are met appropriately, but we're also taking a good look at telehealth now and how that might benefit us not just now, but going forward with making sure that we can provide a standard of care to our patients and making sure that we can keep both provider and patient safe.
I really appreciate how it tells me my microphone is muted as soon as I start talking, so I don't look like a chump for quite so long. Next up, we are going to hear from Dennis Cow, the founder and chief and, grand poobah of Proactive Information Management. Tell us a little bit about what you bring to the table today.
Sure. My name is Dennis Gow, and I'm in the IT side for Proactive Information Management. So we do all things IT, including help desk support services and server-related and IT security. Work a lot with Centrovance and her team on helping medical practices and other businesses improve their IT security.
That's awesome. And last but definitely not least, we have my boss, Manic Maple, Tiffany Joy Green, and she is our Chief Growth Officer at MPWRSource, and she is really good at telling people how to plan things, but also she has other gifts. Take the wheel.
Thanks, Elizabeth. And as everyone should know, Elizabeth's name is Word Girl because that's her superpower as content developer. So at MPWRSource, we are a collective group of superheroes. And what we do is we bring all those superhero powers together to help healthcare businesses and small businesses and accounting and finance firms, all these small businesses, to help them achieve growth, peace of mind, and also to be able to operate efficiently. So within MPWRSource, our superhero powers are marketing, communications, public relations, and sales. And then we call upon Proactive and Centrovance and advisory services to bring their superpowers to the table because we believe much like Spider-Man, that everything is like a spider web, interconnected, and only works well when working well together. So we offer that holistic approach.
That is awesome. And with that, now that we sort of know who, oh, it looks like we have some more people here too. That's very exciting to me. Oh, I did want to introduce Dr. Mancia is here. And Dr. Mancia, if you could turn on your video, that would be great so people could see you, and then I can introduce you and we can hear a little bit about what you bring to the table today as a doctor who uses telehealth services now. That would be great.
Yeah, right there. I do have my video on. I don't know why you.
There we go. We see your
Okay.
lovely face now. Thank you.
Okay. Can you ask me again? I'm sorry. I was looking at the video.
Well, I just sort of introduced everyone, and I just wanted you to introduce yourself a little bit so that everyone who is watching the webinar knows who you are, what your medical specialty is, and maybe how long you've been using telehealth and those sorts of things. And then we are going to get into the questions I have prepared.
All right. Well, my name is Olivia Mancia. I'm an internist and geriatrician in Midlothian. Been here for almost 18 years. We do provide care to the community we're bilingual. We do mostly, Hispanic community. We're very well known. We have been actually playing with the idea of the telehealth as they have come available, doing it in a very minimal way until COVID came to, to play along, So since then, since the past 5 weeks, we had to close the clinic and we turned into telemedicine, and it has been, I want to say, very successful. A lot more acceptable from the patients, especially the regulations have dropped and eased out, so it's easier to see patients through telehealth with insurances. So our hope is that this will open the field to stay and be able to offer the services, in the future without having to, roll back and have to have so many limitations.
Yes, I think that's one thing that as I've been researching for today's webinar, a lot of people have been right on the edge of maybe dabbling in telehealth, but then as coronavirus hit, it was like everybody on board was like, oh, okay, we now have this great thing that we can use, and maybe we can do certain things that are more efficient for everybody once we enter whatever normal is going to look like in the future. But it's great to utilize it right now during the pandemic, but it's also something that's going to serve us well in the future during cold and flu season. But also with that, I just wanted to know, I'll probably start with Angela here. In order to get telehealth services up and running, I'm guessing that it's not just plugging something in and it's not just FaceTiming with a patient. But what are some of the parameters that a doctor's office, that a practice needs to consider to ensure that their telehealth services are HIPAA compliant? Because my guess is that's going to play a huge role here.
So I think the one of the most important things is that we can put you can use a platform that gives us a claim of HIPAA compliance. And right now we've expanded that, or Health and Human Services has actually expanded that to include more platforms than what we would normally use, though they are still maintaining discretionary control to enforce if they see that there is some kind of egregious issues with providers and performing telehealth services in insecure manners. So HHS still does have that discretionary enforcement action at their fingertips. So all of that said, there's a lot of platforms that are out there, and FaceTime is one of them that we can use today. Zoom is probably not one I would use today. We've seen a lot of security issues over the last couple of weeks with Zoom. DoxyMe is one of those that are out there. There's a lot of different platforms that are available. Some of the EHRs that we're using also have telemed platforms, and so that's a good idea. What we can't forget, though, is the people piece, and that's what's going to always create the issue for us. So if we have providers who are providing telehealth services and they're doing that remotely, who owns the computer? Hopefully it's the practice. Who set up the security on that computer? Hopefully it's a professional IT group that works for that practice. And then have we put some limitations in play, like they can't print, they can't screenshot, they can't plug USBs in, they can't download software. So lots of things that we can do from a technical perspective. But we also are going to have to think about this from a policy perspective going forward as well, because this is not simply remote work anymore. Now we are talking about telehealth, and this is probably going to be a model that's going to expand. To what Dr. Mancia said a few minutes ago, I hope and I expect that CMS is going to have to lighten the reins, not just for now because of the pandemic, but going forward, they're going to have to do that. And then we're going to have to come to some consensus with the private insurance industries as well, either through federal rule or state. I would prefer federal because that would require everybody to do the same thing. When you have states, then you can have a hodgepodge of rules. But we need something in place that allows not just our Medicaid and Medicare to expand, but also our private insurance, and that doesn't allow the private insurance to say, we're not going to cover or we're not going to reimburse, because now what you're doing is you're blocking access to health care to individuals who may not be able to come into your practice.
One would imagine that an insurance company would like to support something that's more efficient, but then again, we're trying to imply reason in an arena that has yet to prove reasonable. Right. But I do think I know I've spoken to Tiffany about this before in the past. There is a little bit piece of telehealth it's very technological, but it's almost like returning to a house call. So it's sort of the modern version of the sick person staying where they are and the doctor going to them, which I like and makes complete sense to me. And so, as you mentioned, Angela, there's obviously going to be a difference between maybe the way telehealth services are offered now as they be in the future. From what I'm understanding, what you're saying, there needs to be parameters in place that are different if, say, the doctor's going into the office and has a space set up in their office from which they provide telehealth services, or maybe a nurse practitioner or whomever the healthcare provider is. That there are going to be different parameters for that than if, say they're at their home giving telehealth services. And obviously, fingers crossed, in 6 months, it's going to be they're going to their office. But maybe right now, it might be they're at home. Am I correct in assuming that there are different parameters for those two different environments?
Yes. So you're more controlled as a general rule if you're providing those services from the practice. And I would say truthfully that where a provider can, you should go to your place of business and provide those services. There should, generally speaking, there's not going to be an issue with social distancing at work if you just have your providers there and maybe somebody at the front desk. So that's all. I think that is a perfectly fine solution. The health department would agree with that as long as you can socially distance and we're disinfecting appropriately. Having your providers on site performing the telehealth services is appropriate. If you absolutely have to allow them to do it remotely, then we just need to strengthen our policies around that and make sure from somebody like Dennis's perspective that we have the right security in place on whatever device is being used, and that we have some rules that surround what their home office needs to look like. Where in the home can you provide this service? What level of privacy do you need to have? Even though in today's environment, So when we think about telework versus telehealth, in a telework environment, you know, maybe your spouse walks by or your kids come in and ask you for something to eat for the 1000th time today. But in a telemed environment,
I can't relate to that at all.
You can't relate to that? Yeah, no, me either. I think Langston eats 3 breakfasts, 3 lunch, and 3 dinners a day plus snacks. So we have to think about those considerations, right? That with telemed, we have to ensure we are not going to have those interruptions, because it is not just about, did somebody access my computer or did somebody look at somebody's medical record? There's an unauthorized use or disclosure of the information. Is somebody hearing it, somebody seeing it, somebody accessing it? So we want to be very careful as we move forward in this, because I see this as being our new normal. We just need to be very careful that we set up policies. And this is one of the things that I do like about what we are doing with MCH Concepts, right? That we are able to come in, we are able to offer the security portion. We're able to offer marketing. How do we get this out so that our patients know what we're doing, what we can do for them? We're able to offer the compliance piece for them. We're able to provide this medical director that can speak to what's happening and answer questions. So I think that, you know, going forward, this is leveraging something like MCH Concepts is going to be helpful to people that are looking at, and practices that are looking at, how can we get this incorporated and how can we be more efficient? Because I think that in the end run, this is going to make us more efficient.
I think you gave a really nice segue to my next question, and that is, this is going to start off for Tiffany. So let's say I'm a physician. I've got my telehealth services sort of set up, and what do I need to do? I assume I should tell the patients.
No.
What does that look?
Hide and seek.
So maybe hire a skywriter. That's your suggestion?
Wing it. Just wing it. See what happens.
Okay. I feel like that's a lot of people's plans already.
I know, but we all know that's never my plan, because my plans have plans, and then they have baby plans. So for marketing telemedicine, number one, I always say you have to think about your website. It has to be listed on your website. This is how patients are looking for their providers, is by going online. So obviously you need to have it on your website. And in order to do that, where should it be? It should actually be, especially right now, front and center on your website. Not, I've been scanning a lot of medical practices, and they'll say, hey, we offer it. I can't find it anywhere listed on their website. And then, oh, wait, oh, there it is, buried down on the 5th page of the website. Oh, that's not very useful. You also want to make sure you list it as one of your services, because most people will have a tab for services. Make sure you list it as one of those. So then you give that telemedicine its whole page, and on there should be a lot of information about what kind of telemedicine it is you offer, what service, what's the third-party service you're using to be able to give it, what are the directions for the patient to follow in order to be able to do it, because obviously with telemedicine, one of the hurdles is making sure the patient also understands how to access it, what to have in hand and ready to go in order to get that ball rolling. So it's all about sharing all that information up front. And then, you know, it's also a great opportunity to share any information that you have and blog about it. Talk about the best uses that you're using your telemedicine platform for. I know obviously you're not going to share patient data on it, but it doesn't mean you can't make up Jane Doe. I saw Jane Doe today, and this is how telemed worked for her. Also, I have some notes, so bear with me. Again, if you have a telemedicine, I know you're laughing at me. Stop laughing at me. But another thing is you want to make sure you send an email out to all your patients saying, hey, I got telemedicine. Here's some things you can do right now to get yourself, if you're interested in this, to get squared away, download the app or whatever it might be, and get your information in there so you're ready to go when you want to use it. Make sure you inform all your colleagues, your friends, family, literally launch it out to everybody. if this is something that you're saying, hey, you know what, this isn't just a temporary fix for now, for the next month or so, like you're going to adopt this as part of your medical strategy, your business strategy moving forward, this is a great time to also do a direct mail piece to the communities that you are serving to say, hey, this is another service that we're providing you. So some basics. Have some print brochures in your practices outlining the service. Make sure you have flyers in the reception area and all your patient rooms saying you offer this service. Use social media, and if for medical practices, you need to be using Facebook and be talking about that on your Facebook. You can also be doing right now, pay-per-click ads and Google ads are a bit cheaper. Promote it there. Also, make sure to add your names to a lot of databases out there to make so that your patients can leave reviews, and hopefully they too can share their telemedicine experience that they had with you. Again, blog about your services, make videos. Make videos. Did I say that loud enough? Make videos. People watch videos.
You said, we know. Tiffany loves her videos.
I'm not the only one who loves videos. The market research says people love videos. YouTube is the second busiest, most used search engine tool today, because why? People don't want to read. They want to watch. So use your videos to show how they access telehealth, what they can use it for. So this is a great way for people to get to know their doctor too. Host webinars, just like we're doing today. Another great option. I know, right? And then you can create groups through your social media. So depending on what kind of medical practice you have, there's some other options there too. So there's a lot of things you should be doing and considering for in terms of marketing and communications this particular service.
I know you love your videos, but there is actually one thing that I wrote down that you said that is not as modern, but I really like the idea of the flyers and the direct mail, simply because I can imagine having a postcard or something that I pick up at my doctor's office and sticking it on my refrigerator. Mm-hmm. So that, okay, I'm feeling sick, and first of all, I've Googled it and I've convinced myself I have coronavirus, because that's, every symptom, that's what I assume. But then I remember I still smell my child, so I'm okay. But maybe I need to call. If I had it on the refrigerator, then I could immediately know how to access my doctor. And I do know that there are some apps available. Can Dennis, I want to find out from you what technological, what tech is probably needed to set this up.
Yeah, so I think there's a couple of challenges in telemedicine that I have seen, and I think Dr. Mencia can probably talk a little bit more about that from a doctor and patient side, and just working with her, figuring those things out. But from a practice perspective, obviously you need to have good internet, right? And just because you only have one or two doctors that is on a telemed doesn't mean that it's not using more bandwidth than what you will usually use. So I think having good bandwidth is obviously really important. The second thing that I believe is really important is the platform that you use. Most EHR, if you're using EHRs out there, they have some platform that's already built in, but some of them don't. So you will be able to use a website like Doxy.me, or you'll be able to use FaceTime right now since they relaxed the regulation, and even Facebook Messenger. But I still think that you need to really think about the devices that you're using, what kind of speed you have, and the device that you're using, and if that device is secure or not. I think that there's certain aspects of that the government relaxed the regulation that we can just do kind of whatever we want. And that's not the case at all. I think corporately, if you are a corporate infrastructure or a company who adhere to HIPAA standard, and I'm sure Angela will love me saying this, you need to still continue to practice that, and that will be best practice. And don't just get on a computer at home that is not part of corporate network, that does not have any antivirus protection or such, and start doing communication, because it's no different than just going to Starbucks and using their public Wi-Fi to do your bank account, which people say don't do that. And so those are all the things that I think as we're gearing up and kind of coming back to normal, people need to really think about. But as we're coming back to normal, especially when you're in the office, you really need to start thinking about your bandwidth and also the connection from the standpoint of having dual connection in the office. What if one connection goes down? Do you have a backup connection? Most doctors should have some sort of iPhone or Android phone or cell phone where they can use that as a hotspot. So those are all the things that I think you need to put in place to kind of think about your workflow, because your workflow is definitely going to be different, right? And so there are going to be some challenges, I think, as we go through doing this. But I think Dr. Mencia might be able to share some of her experience as a doctor about how we deploy the telehealth services. So.
You guys are really running this relay well in terms of passing the baton. I just want to say that y'all have done a great job, because that was my next question, was to ask Dr. Mencia. You may be able to speak to some of the challenges you have experienced as a healthcare provider, as a doctor, and maybe also speak to some of the challenges you have seen your patients experience as well, because I think that's important for a doctor to know, okay, I'm having this struggle, but I also need to meet my patient's struggle as well. What have you seen?
I think that, since we started 5 weeks ago, our EMR has the capability of doing virtual visits. With that said, it has been horribly difficult for patients to get through it. So, we had to resort to different options. The population, part of the population we serve, we do geriatrics here, so a lot of elderly patients don't have the capacity to really be running around and trying to click on this and do that. So we have resourced to so many different platforms. So we are mostly using Doxy.me right now, and it has been amazing. I think our success with Doxy.me has been at least 90%. Very seldomly we have a patient that cannot put the camera straight, and then we're looking at the car instead of looking at their face. It's small things like that, right? But we have used anything between, at the beginning we used Zoom like a couple of times, but I immediately realized it was not a good idea to be doing that. So we're doing between our EMR, which is being, I want to say maybe 30 to 30% successful for us. Doxy.me the best. We've done FaceTime, and I would have gone as far as doing WhatsApp. A lot of people communicate with family members in other countries, and they don't have anything, but they have WhatsApp. So, for the most part, a lot of the challenges for us really have been what Benny was mentioning, the people part, the patient part, having them available, being able to activate that app, or that link to start the communication. Once it's started, I have found patients are welcome that immensely. My elderly patients love it. They every time, oh, I love to see your face. It feels good. It's really your alternative, like the house call that you were mentioning. Of course, there's so many limitations through it, but I think there is a huge, opportunity, and it's a big platform for us to be making some changes in how we practice medicine in certain types of visits.
Yeah, I want to add to that really quick, is that I think for practice who is going to want to engage in telehealth or telemedicine, they really need to prep their front desk and the people in their nursing and MA to be able to fill in those tech support purpose calls. Because I have seen that, and just going to different practices and hearing what they have talked about, is that they are behind in schedule a lot, because if the patient is going to be seeing at 8 o'clock, they couldn't get on, and once they get on, they have technical difficulty, and all of a sudden that particular call is now at 8:20. And so now I just push the whole schedule back for the next patient. So that's been the big challenge is, whatever platform you want to use, it doesn't matter if you're in PCP care or family doctor, all the way to dermatology, all the way to pulmonary or whatever. It's whatever it is that you're doing. You really need to think about that your staff is now going to become the primary point of contact of dealing with the patient on tech support issues. Simple as if they get on doxy.me, for example, and they do not turn on the security feature to allow microphones to work, you can see their picture all day, but you can't hear them at all. And so then all of a sudden they're trying to call in and you got feedback and all that stuff, which is really the barrier in making the telemedicine successful, right? So if you are, and most of the patient population, obviously, is they're going to see more doctors, are the population where technology is not something that they're used to, right? I mean, they're the heavy users, if you will, of the technology. So I don't think it matters whether you are geriatric or you're internalist or pulmonary or dermatology. Your patients that come see you often are the older population, so that technology is not something that they are used to. So really, the front desk really needs to work with IT and figure out a standard process procedure and be able to provide the patient engagement or success with the patient engagement, because that's been the biggest challenge that I've seen so far. I know yesterday I was at a practice and they were delayed by half an hour because one of the user couldn't figure out how to turn their microphone on. So they couldn't talk to the providers, and the provider's been sitting there for 15 minutes already. So.
And I will say, even as a non-geriatric person, I am very technologically savvy. I have received that email with the link from Doxy to meet with my therapist. And even then, I'm like, well, wait, do I click on this? So there is a learning curve, even if someone is used to it. And what time are those reminder emails coming through? Because I know my appointment will be at 9:30. Well, if I don't have my reminder email by 9:15, I start freaking out and emailing my provider, and then I'm getting different emails. So there definitely is, you talk with your front staff and make sure when those link reminders are getting set out so that people do have time to adjust and make sure it's, their phones are pinging to tell them what to do. And before I get to you, Tiffany, I promise I'm coming, but I want to just remind everyone that if you were not talking, to please mute your microphones. And now I'm going to mute mine and Tiffany's going to talk. Go.
Again, it's about communication, right? And I think everybody, we're in a technological age, so we have this telehealth app or telemedicine app, and everyone just like click it and it works. Well, it's just like any other tool. We've all worked with, and not just seniors. Let's be clear. I've worked with some young people where they may not take to certain things, not mentioning any names, very quickly. So this is where video comes in handy. When you open up your telehealth app or website, this is what you need to do. Step 1, lay it out. Put that in the link. Put it on your website. Clear written out directions so that they can follow. Some people are visual. Some people need to digest it and read it, comprehend it. This is where it's very important to not just market it to say you have it, but how does it work? Here's where technical writing comes to play, and this is how you show people how to do it. And I don't really see many medical practices doing that. In fact, the one I used a couple of months ago, I was having the care I got was great. I did not like the app. I called the office. They couldn't direct me on how to use it at all. And that goes back to what Dennis was saying, which is you've got to instruct your staff on how to use it. So if somebody does call, it's okay. Yes, ma'am or sir, this is what you need to do.
Yeah, I would say consult with your IT team to kind of help with your medical team to write an SOP, because a standard procedure policy of how to troubleshoot, because most of the practice that we work with, the reason they have us as their client is because they don't have an IT team, right? So they can't just have somebody to reach out and help with tech support. So it really is important that either the medical assistant or the nurse practitioner have somebody that is technically proficient, have a small team to be able to engage with that, because they're just going to be as frustrated as you are. And I believe that if you don't prep your MAs or your team or your front desk person to really understand how to troubleshoot that problem, then it's not going to be successful. And not only is it not going to be successful, you're going to be even behind now on your scheduling and stuff like that. And this problem is going to get even worse, right? I mean, there's going to be a huge confusion now, as in we're going to have patients coming in, And we also gonna have a subset of patients who cannot come in because they may have COVID. And we also have patients where they may need to do it from their phones out in the parking lot, because once they arrive to your site, you take their temperature and you have decided independently, or the practice, that they do not fit a certain criteria for them to be in a waiting room. So these are all the challenges I think that needs to be run through your team, because it's not just a technical challenge. And where it becomes important is that whatever that workflow is, you need to communicate with the technology team so that they can prep for all these things and trying to smooth things out on the back end as much as you can. So if you don't let them know and they're not doing it, it's not simple. What I've seen is not simple as just providing a link and click on it. I mean, of course, that's what everybody makes it out to be, but the details in the pudding, right? The detail is really in that when they call and they have that patient engagement, it's not there. What are you going to do? And all of a sudden, your MA and your front desk is now on the phone, and now they also have to deal with technology issues. So I think that's the biggest barrier. I know that over at Dr. Mencia's office, I was saying that that their front desk staff has really done really well. The other option that you could have too, and I know that Dr. Mencia kind of deployed this, is when you call for the night before for confirmation, maybe you could change the workflow by calling the patient that's in certain demographic, certain age group, and do the pre-testing with them the day before to make sure they didn't get on, and so on and so forth, so that it works before their appointment the following day. So those are all some of the strategies you can deploy, but I think that's the biggest barrier in all technology is that. And of course, have multiple devices ready to go for doctors, right? So most of these services are supported by iPad and by cell phone and by computer. So have the app ready. Show the teacher, show the doctors on what they need to do, how they need to do it, and so that if they're in the middle of doing something, and Murphy's Law is that when you need it, that's when the thing will break, right? Then they have another device they can go to so that it doesn't back up their patient schedule. And I think those are some of the biggest challenges. You're now solely dependent on that piece of equipment to interface with your client, if you will, right? So I think those are all the challenges that you will see as we come back up, because you're no longer just dealing with walk-in and phones anymore. Now you're dealing with walk-in phones and computers. And that puts a lot of pressure on your MAs and your front desk people as we continue this new environment of practicing medicine.
And that's true. And I want to, another challenge and a question that I have seen from a lot of people, and, I think it's great. We're going to be able to see more patients. We're going to be able to grow healthcare practices. But there's also, let's be realistic. Everyone likes to get paid, and your patients let's just be good to all the patients. The patients like to pay their bills. And so does insurance cover telehealth visits in the same way that it does a regular visit? Whoever knows the answer to that should answer. So, what are the differences there in terms of how it's built? I think Angela might know some of this too, and also Dr. Mencia having done it for a bit.
Yeah, so you kind of broke up there a little bit, but I think what you were asking was about reimbursement for telehealth services. So there's a couple of things that we have to be concerned with. Number one is that it's all very much insurance driven. CMS has broadened their scope and what they will allow a provider to perform or to provide via telehealth services during this pandemic. I hope that it's going to mean that we're going to broaden that and make that a permanent solution, because we're seeing what's happening, right? There's this huge benefit, transportation for the patient themselves. We're not bringing sick patients to our practice, so we're reducing hospitalizations for people that don't need to. We're reducing the number of days that people end up staying in hospitals. We're reducing our organizational costs. So there's a lot of benefit to this, and I see that it will broaden. So right now, CMS has broadened theirs. There's no one rule that applies to private insurance. So we have to rely on our states to give us the guidelines and put a rule in place. So right now, there are 31 states that have parity laws that say that the insurance company is going to have to reimburse at the same rate that they would if they saw you in practice. We still have 6 that are out there that have some proposed legislation and another 13 with no legislation. The good news is Virginia is one of the states that has the parity law. So they have to reimburse, the private insurance has to reimburse at the same rate they would for a patient who was actually seen in the practice.
Hey, Angela?
Yes.
Can I interject a nice statistic?
Sure.
Okay. So, interesting fact. So, provider to patient telehealth conducted outside of hospitals is becoming an increasingly larger slice of the pie. So, accounting for 52% of total telehealth insurance claims.
Right.
So that, I mean, it's increasing. So, I mean, it's working.
So
I think there's a fear.
Yeah, I think what we have to look at here is, you know, and this is the time to leverage change. So what do we know? What have the researchers been looking at since COVID-19, since this pandemic started, right? It's what we're talking about, but we're not going to be talking about this pandemic forever. So as we change this model, why is it important? Why is it good to maintain the COVID-19 pandemic model? Because what the research is showing is that we're having 38% fewer hospitalizations. That's a good number, because obviously that is a burden on, not an economic burden, not just on society and on the patient, but on the hospital and the healthcare industry as well, and on the government. We're seeing 31% less readmissions, and that's another important factor when we think about it. And 63% reduction in number of days that patients are staying in the hospital. So they're likely not to have to stay in the hospital for a longer period of time. The other thing that we're seeing is a whole lot more engagement, right? So now I know, and I've said this before on a webinar that we had done before. Most of the time when I go to see my provider, I'm going in for some blood work. I'm going in for, the well check or a physical. And I get in there and I'm listening to all these people coughing and hacking, and I don't want to be in the waiting area. Or it's just cold and flu season, and I just know that there's people that are sick, whether I can see it or not, and I don't want to be in that waiting area. So this is our opportunity to use more telemed, to change this whole dynamic. And we start off those visits, once they're established patients, we start off those visits where if we can handle this via telemed, we do. And if we can't, then we let the patient know that we need to bring them in, but give them the option and us the opportunity to evaluate if we actually need to see them in practice, or if we can do a telemed and provide them guidance and start with whatever level of diagnosis, and then prescriptions via the telemed platform, and then save the in-house visits for just those that are necessary, which then reduces the crowding in waiting areas and the likelihood that we're going to spread disease, which is what it's all about, right? The more crowded an area is, when you have somebody that's sick, the more likely other people are to get sick.
And that's true of every illness.
Yes.
That's not unique to COVID-19.
That's not just COVID-19. And I think that's an important, we have, and I don't want to diminish the importance or the impact that COVID-19 is having worldwide. But at the same time, we are so focused on this. And unfortunately, there's so many talking heads out there that it's very hard to find who's the voice of reason. Who do I need to listen to? Because I've got all these people that are saying scary things, and I don't know what I can do or what I shouldn't do. Should I just stay in my house? And one of the concerns that we have is that as people stay in their homes, even well people, stay in their homes and sanitize over and over again, 21 times a day, that as we get back to normal and we start leaving our homes, right? Even well people, now we're going to be exposed to all those microorganisms that are a part of our daily life and that help us build an immune system. But when you suppress an immune system, now you make your population, even the well population, more susceptible. So there's a lot of things that we have to think about. We're going to have to get back to a normal on some level. But when we think about healthcare, how can we make sure that we're not exposing well people to disease processes or to infections that they don't need to be exposed to? And we can do that through telemed, right? So instead of having a bunch of people sitting in the waiting area sick, we screen them through telemed and then we bring them in as is appropriate.
So Tiffany, did you want to speak to something about that?
Yes. So what I wanted to add was, based on what Angela was saying, okay, we're looking at COVID-19. What does that mean? But this is going beyond COVID-19, right? COVID-19 is the topic of conversation today, but it's not going to be the topic of conversation forever. And so if you want to look at market research pre-COVID-19, right? 76% of patients prioritize provider access over human interaction. So the availability, the ease of use is more important to them than the actual human interaction. 83% of patients felt the quality of care in telehealth visit was as good or better than an in-person visit. And 90% of patients no longer feel obligated to stay with a provider that can't offer a satisfactory telemedicine visit. So that is even pre-COVID-19, before we were all concerned about infection control. People want the ease and they want the accessibility that telemedicine offers. And that, again, pre-COVID-19. So what does that mean now that COVID-19 is here? So let's look at it this way. I was talking to one EHR provider, and they said before COVID-19, telemedicine had a 2% monthly utilization rate among their healthcare providers. In March, it went up to 35.6%. That's a substantial increase. And it's not just because the patient was actually wanting it anymore, because as you could see, the stat said the patients already wanted it pre-COVID-19. What's making a difference is now the healthcare practices are jumping on and now are actually offering it. So I think healthcare practices, it's like just what I always say in marketing, and Elizabeth's heard me say it before, marketing is always about meeting demand, not trying to create demand. So the demand is already there for telemedicine, and now is the best time to just kind of get on that wagon.
Yeah, I think it's important, though, to be very clear that, first of all, when we look at telemedicine, this is not something that we've had forever, right? So it's not a traditional model. We have gone from in our society from the home visit for our sick patients to being seen in medical practices and then hospitals, specialties and all of that. And so telemedicine has been available, but one of the important things to remember is that the insurance companies, the health insurance industry is who controls this, because it doesn't matter if a provider can provide care via audio video streaming. If the insurance company is not going to reimburse, then that is an economic burden for the patient, right? We can self-pay on telemed all day long. We can take their money, provide services if they want to be self-pay. But when we start talking about insurance, now we have to know what the insurance company says about what can you provide and what are we going to reimburse. So that's where the state rules are important, right? Having those in play. That's where CMS expanding their list of services is important. And this is where I think the medical world, people like Dr. Mancia and her peers are going to be able to say and lobby through associations that, you know what, this works. We're able to provide a better level of care. And so we need the insurance companies to relax their standards. We need them to allow us to see our patients. We need them to reimburse us appropriately when we are seeing our patients, not penalize us for trying to provide a safer model of care.
Because potentially one would think that this would be a way to reduce a patient's healthcare cost. Yes, and Dr. Mancia?
Stepping on that term, you know what I've noticed is the compliance of the patients have improved. You know, their safety also, because just a simple example is, you know, our patients are reaching out to us because they don't want to go to the emergency room now. They don't want to go to an urgent care center because they know they're at risk. So they're reaching out to us, and they know they can find us, you know, and we can have a face-to-face conversation. If we have a patient who is established, you know, for the most part, we know the patient and we know what the chances are of what's going on with them, you know. So after a good conversation, a good, you know, interaction, we can probably, you know, deal with, you know, at least 60–70% of any issues, you know. But on the other side, it comes what is the routine care on our patients, right? It's a perfect example is a diabetic patient that takes blood pressure medicine and uses insulin, and it's working. The patient is working, is not able to get here to be evaluated just because they need the refills and do, you know, the testing. So now we can get those patients to go do their testing on a weekend, and we can do the follow-up through a televisit, you know, and then we can go over results, make adjustments of medication safely, and that patient just took a 15-minute break from their job rather than losing the whole day, you know. They're refilling their medications on time, they're not canceling and rescheduling visits 3–4 times until they are actually able to make it, because the employer is not allowing them to you know, to miss work. So there's a lot of things that we're going to be able to support to continue this system of, you know, of care. Of course, there's going to be limitations. There's going to be times the patient needs to be here, but for the most part, I think that this is really open brand new doors for everyone.
I think you made some great points, Dr. Mancia, particularly as we sort of wrap things up about, you know, routine visits that can be covered, prescription maintenance, follow-up visits, things of that nature that can really be utilized in it, meeting a lot of needs, from saving time to saving money to, you know, saving exposure, like those at-risk parts of our society, whether it's someone with asthma or someone with diabetes, someone older, you know, and even let's just put someone who may not be at risk, but that mom whose kids are suddenly not in school. How is she can't be trotting them out to the doctor, but she needs her prescription refilled. And, you know, I'm choosing my pharmacy based upon who I can drive through. So this is definitely going to make a lot of people's lives easier. Now, from a doctor standpoint, Dr. Mancia, is it pretty easy to e-prescribe through telehealth?
Well, as long as you have your EMR, you know, available. The original idea through EMS was that we were supposed to be, the EMR had to be embedded into the virtual visit into the EMR to make it, you know, legal. So, but now I'm talking to you right now, but I have my EMR in the other screen. So as I talk to you, I have your medical record open, and I know I can do e-script anytime. So it's easy to do. It's extremely easy to do as long as you have access to your EMR. And most clinics at this time, you know, I think they have EMRs. You can see a very few practices here and there with very older physicians that have never really turned into the EMR. But even then, I've seen physicians practices that they don't have an EMR, but they have sure scripts. So, you know, so they can still send prescription refills through, you know, or through the internet.
What Dr. Mancia is saying is what our whole, if we look back, this is what our whole push towards the electronic record was, that we would be able to provide this model of care, that we would get rid of paper scripts, that the fewer mistakes, less chance of fraud. The doctor can e-prescribe, it leaves the doctor, it goes straight to the pharmacist, and then I can go pick that up. But this was also, when we started talking about the electronic records, this was about making sure that patients could be more involved in their care, because they need to be, right? And so when we can provide all of this, everything via an electronic method, and there's still doctors that are holding out that are not using electronic records, and there's nobody right now that's going to twist their arm and make them. But I think at some point that we are going to be on that model wholly and completely. One of the things we are going to have to do is that we've got all these EMRs out there and they're very fractured right now. So if I go out to California to visit and something happens to me, the doctor out in California doesn't have access to Dr. Mancia's EMR. So we're going to have to see at some point where we're going to get things interconnected and where information is going to be able to be shared in such a way that we still protect privacy and security, but we also maintain a standard of care where patients can be treated no matter where they are. So I need to be seen in California for an emergency. I need a prescription out there, whatever the case may be. I think we're going to see a huge shift, and we already are. Everything is going electronic. Telemed's the next piece.
I think you guys are some smart people, and I was glad to be here with you today. I know I learned a lot, and I'm hoping that our attendees learned a lot as well. And I hope people, I'm going to upload the recording of this webinar. I'll make sure everyone has a link for it, and to our participants and to anyone who watches this, if you have any questions, you can send them to me. I am EJ Phillips at MPWRSource.com. That is EJPHILLIPS at MPWRSource.com. You can send those questions there, and I will make sure that they get to the correct parties. You can also contact, now wait till I spell this one, Angela Simmons at Centravance.com. It's just Angela at Centravance.com. Google it, figure it out. We've also got Dr. Mancia. She can be found as well. And Tiffany Green is TJ Green at MPWRSource.com. And Dennis Cow, I do not know your email address. Does someone know Dennis's email? Is it DKAO at proactive-info.com? See, I do know things. Hooked on Phonics World. But I wanted to thank everyone for coming here. I will make sure to follow this up with an email with all the information that you need, and it will be posted on our website as well. Each of our panelists, thanks for your expertise. As always, it is great to be in my dining room, but also be here with you. Thanks so much for stopping by. All right.
Thank you. Nice to see you all.
Bye.